Radiation sickness, also called acute radiation syndrome, ARS, happens when a person is exposed to a high dose of ionizing radiation in a short period. This can occur due to nuclear accidents, radiation therapy gone wrong, or exposure to radioactive materials from weapons or disasters. The severity depends on the radiation dose, exposure time, and which parts of the body were affected. The symptoms of radiation sickness don't always appear right away. In mild cases, people might experience nausea, vomiting, fatigue, and headaches within a few hours or days. But in severe cases, exposure to high radiation levels can cause severe damage to the body's cells and organs. There are 4 stages of ARS: the prodromal stage, immediate nausea and vomiting, a latent period, where symptoms temporarily improve; the manifest illness stage, severe symptoms return, including infections, bleeding, and organ failure; and finally, recovery or death. Radiation affects fast-dividing cells the most, which is why it damages the bone marrow, intestines, and skin. People with severe ARS can suffer from internal bleeding, a weakened immune system, and neurological damage. In extreme cases, exposure can be fatal within days or weeks. One of the scariest effects of radiation exposure is long-term cancer risk, especially leukemia and thyroid cancer. Survivors of nuclear bombings, accidents like Chernobyl and Fukushima, and workers in radiation-heavy industries have shown higher rates of cancer and genetic mutations over time. Treatment for radiation sickness depends on how much exposure a person had. If exposure was limited, supportive care like fluids, anti-nausea medications, and antibiotics can help. In severe cases, doctors might perform bone marrow transplants to replace damaged cells. Potassium iodide, Ki. Pills are often used after nuclear accidents to block radioactive iodine from affecting the thyroid. In some cases, special drugs like Prussian blue and DTPA help remove radioactive particles from the body. The best way to prevent radiation sickness is to avoid exposure whenever possible. In a nuclear event, staying indoors, wearing protective gear, and following emergency instructions can reduce the risk. Radiation is invisible and can't be smelled or felt, so monitoring with radiation detectors is critical in hazardous areas. For people who work around radiation, strict safety protocols, protective suits, and exposure limits help prevent long-term health effects. While radiation sickness is rare, it remains a serious risk for nuclear workers, military personnel, astronauts, and people exposed to radioactive disasters. Understanding how it works, how to treat it, and how to stay safe is crucial in minimizing its deadly effects.